We're here to talk about the WHO's 25 by 25 goals. And to do that, I'm with Dr. Salim Yusuf, who is an MD. He is a professor of medicine and the director of the Population Health Research Institute at McMaster University. And for our purposes here, we should also note that he's the president of the World Heart Federation. And in this case, it's the World Health Organization that you're involved with for the 25 indicators, the 25 for 25. Tell me about it. What's it meant to do?
Well, we all know that cardiovascular disease is the world's largest epidemic ever in history. And it is the commonest cause of death globally. So further, the world's causes of death are shifting from childhood diseases and diseases of poverty to now the diseases of plenty and in middle age and old age. Out of the 55 million deaths in the world, about 17 million are cardiovascular, and of those, 80% are in the low and middle income countries. So we have a global epidemic that actually disproportionately affects the poor countries, and within the poor countries, it affects both the rich and the poor countries. So one of the myths that we need to dispel is that cardiovascular disease is not just a disease of the rich, it's a disease of everybody.
So the WHO has developed this kind of a global monitoring framework, and they talk about 25 indicators. They talk about mortality and morbidity, and that it's one leg of this.
So I think the goal is to reduce cardiovascular disease mortality below the age of 70 by a quarter in the next decade, 24. That's huge.
Yeah.
Now, the cardiovascular disease rate globally is actually coming down at 1.2% per year. So half would happen anyway. But to push it to the next half, to double that, is a huge job. And the business as usual, again, depends that we aren't going to have worse outcomes from smoking or more obesity or more diabetes. So business as usual itself won't achieve it. The second thing that that is needed is a monitoring framework. You need to know your data. If you know your data, you'll do something about it. So the first thing is to set up approaches of collecting data from different parts of the world. The second thing is to prioritize. We can't do everything. So we have got to take the things that really we have evidence for. And the World Heart Federation has prioritized 3 areas: tobacco control, hypertension control, and secondary prevention. And if we can target these, 8 out of 10 cardiovascular diseases originate from this population. So if in that population we can reduce events by 1/3, you've achieved your 25 by 25. So the World Heart Federation's role was in identifying the strategy and simplifying it and focusing it. And we at the World Heart Federation have done a number of things to try to facilitate this. First is increasing awareness that cardiovascular disease is important, but it's largely preventable. The second thing we had to do was to build capacity for not just doing research and not just treating patients one at a time, but it is actually having health systems changes so that it's easy to do the right thing and harder to do the wrong thing. And for that, we have started a program called the Emerging Leaders Program, in which every year 25 key leaders from many countries in the world are trained in how to translate knowledge and evidence into practice, and how to evaluate health systems, how to lobby politicians, how to change policy. So far, we've had 2 rounds, 50 people being trained, and a 3rd round is happening next February. And our hope is this will continue indefinitely. And our hope is we can multiply the 25 people to 50 or 100 per year. So this way, to build a group of leaders who have the skills of changing systems and changing health. The second thing is we are working on developing a course in primary care for prevention, because most of the cardiovascular disease prevention has to be in primary care.
Exactly.
There just aren't enough cardiologists, even in the wealthy countries, to tackle the problem, and so that's the second prong. The third prong is what we call roadmaps. And the 3 areas, hypertension control, tobacco control, and secondary prevention, we said, well, we have good evidence, but why is the evidence not being translated.
Right.
So the first thing is to do what we call a situation analysis, and that's underway in many parts of the world. Then the next is to find out what the barriers to change are, and then try to work on it. And then gradually, by persuading organizations around the world, empower them to change the health and the systems in their own country. So the World Heart Federation's role is a facilitator role, a role of being of moral persuasion, and gradually make a change. I hope we will succeed.
I mean, sometimes it's got to feel like you're pushing a rock up the mountain, but it keeps falling down. I mean, cigarette smoking, for a while we were making great gains, the numbers were going down. We're now seeing some more smokers, and there's more opportunities from like e-cigarettes,
I think you're
etc.
right. We just have to persist in our efforts. And you're right, new forms of tobacco come around, and I'm not sure what their effects are. They're marketed as being safer. We need the data. Data are still emerging, but one has to have a starting point. They're unlikely to be good. They may not be as bad as regular cigarettes, but they're unlikely to be good for health. So, and you're right, for every step forward, we sometimes go backwards too. So you're absolutely right, Rick. We just have to press on.
But it's a battle worth fighting.
Well, absolutely. It's a noble cause. It is something that matters. And the fruits of victory are not statistics.
Right.
They are lives, they are families. And that's why we all try to do what we're doing.
Well, if you want to find out more, please go ahead and Google World Health Organization and the 25 for 25, because it's really quite an interesting program and project that they have going. For CardioSource World News, I'm Executive Editor Rick McGuire.